Hi everyone. Just wanted to share a little bit of information with regard to your upcoming clinical assignment for the medical assisting program. My name is Dr. Jillian Harrington. I am the Dean of Health Sciences for AGMU Med University. So there is a little bit of additional information that we need to get from you to get you placed for your clinical and moving forward to finish your program. But we also have a little bit of information for you about dress code and policies and those types of things. So first, let's hop over and take a look at the dress code and the policies for the clinical assignment. So your dress standards for your upcoming clinical are no different than what you've had for the clinical laboratory assignments. So when you're working in the simulation lab, you should be wearing your assigned AGM scrubs, appropriate black nursing shoes or black sneakers with no logos. Be careful with regard to jewelry, only conservative, stud earrings, those kinds of things. Do remember that if you have any tattoos that are visible, they do need to be covered. So you may, if you, for example, have tattoo on your arm, you may need to wear a long sleeve shirt underneath your scrub top, or if you have makeup cover up that you put on tattoos, maybe in an area where you can't cover it with clothing, that's fine as well. They do need to be covered. You always need to have your ID visible when you're in the clinical site, so important there. You do need to, and we've just talked about it, I'll mention it again, you need to be using the scrub tops and scrub pants that you're assigned. It's important that we have all students wearing the appropriate scrubs so that a clinical site knows which students you are, that you're with AGMU, and also that you are assigned to a particular program. Each program has different color scrubs. So our phlebotomy students have different scrubs than nursing, then do medical assisting, massage therapy, etc. Make sure you have, if you have long hair, that you're wearing it back in a ponytail or up in a bun or up with a clip, because obviously you don't want to be bending over and whacking a patient with your hair. I myself have quite long hair, so typically wear that, up in a clip, and that's fine as long as it's not going to be falling on the patient if you bend over to take a blood pressure or to interact with the patient. Makeup, needs to be professional and natural, not excessive colors or crazy eyeliners or, sparkly eyelashes or those kinds of things. Facial hair for men must be, short and neatly trimmed. In some locations, they may not allow facial hair, so be aware of that. I don't think any of ours do, but some hospitals don't allow just because of the precautions that they take for COVID. Can't necessarily have facial hair, but I don't think we have too much of an issue with that in our clinic locations. Glasses, obviously, if you have prescription glasses, those types of things, those are perfectly fine, but no sunglasses on the site. If you're wearing sunglasses in, just make sure you're putting them away in your bag, not leaving them on your head throughout the day. Fingernails. Fingernails are an issue that we have. If you have fingernails, if you have like longer nails, gel nails, acrylic nails, those are not allowed in the clinical setting. You do need to just have short, natural fingernails, conservative nail polish, if any. Technically nails should not extend beyond the end of the finger. So just be aware, be conservative in your nail polish, no long, spiky nails or acrylic nails in that case. And you will want to have a watch with a second hand so that you can do things like pulse, etc. But they do not allow smartwatches in those classroom and clinical settings. So just be sure that you're paying attention to that. Another piece of information, perfumes and colognes and scented lotions should not be worn to the clinical site. Keep in mind that you're dealing with patients that are maybe ill or may have sensitivities to different perfumes and colognes. So just be aware of that. Don't wear any overpowering scented lotions or put on cologne or perfume for the day. Great if you want to wear that outside of the clinical setting, but not in the clinical setting. As well. So uniforms, you should already have your uniform, but for the medical assisting program, it is that Caribbean blue color, which is this color here on the top. Just make sure that you are, have your appropriate uniform. We do have This location here, Uniform Outfitters, which is right on John Young Parkway in Kissimmee. I believe it's right by ORMC. You can go there, you can try things on if you want, or you can just order online. There's directions here in the handbook, which you should have a copy of the handbook, but if you don't already, we'll be getting that to you as well. So let's go down and take a quick look at the clinical behavior guidelines. So keep in mind that we can't always send students everywhere that they want to go. We can only send students to locations that we have observed and that are appropriate for the education that you are to be receiving, and that we have an affiliation agreement in place with. Now, in your Meta 201, 202 classes, you may have already submitted some site locations to Dr. Vasquez so that she is able to work out an agreement with some of these sites. But keep in mind, we can't force a site to sign an agreement, and we cannot send students to a site with whom we do not have an agreement. It's very important that we have that affiliation agreement in place. It protects you, it provides you insurance if you're on site, if something were to happen, etc. So if you do have a site that you're interested in, make sure that that information gets to Dr. Vasquez as soon as possible, and keep in mind that we may not be able to meet all requirements or all requests because we cannot force an organization to sign with us, or they may not be an organization that's appropriate for your experience as well. We will place students within a 50-mile radius of campus. Especially now with gas prices being high, it is tough to commute, but keep in mind it's a limited time. Once you're done, and you can move on to doing whatever is appropriate for your job that you have, or moving to a new job. But for this, we are placing you within that 50-mile radius, so you may have a little bit of a drive to get to your clinical site. Make sure that you're compliant with all the health and safety requirements. We will not be placing you if you do not meet those. So that's important. We're going to talk about that in a few minutes. You're expected to get to clinical at least 30 minutes prior to your shift. You're expected to complete the entire shift. If you have to be late or absent, you need to immediately contact the clinical agency, so whomever you're working with at the clinic site, as well as your preceptor for your course faculty for your course. You need to contact them as soon as possible. If you're sick, if you have an accident, if something happens and you're not going to be able to go, it is required. If we have absences that are not accounted for, we have had to fail students in the past that have not met the requirements. Only clinical day changes can be made in emergency cases. Don't plan a vacation during your clinical. Don't plan to go to the doctor for that day, or any appointments that you can shift around and do on a different day where you're not in clinical. Please do so. It's really, really important that you are going to your clinical, getting your hours done, and then being done with that. Make sure that you're abiding by any of the requirements or the guidelines for that organization. So they may have a different guideline with regard to your break time or lunch time or those types of things. Just be very careful to make sure you're following all of their policies. No cell phones are allowed during the clinical rotation. No smartwatches, no phone use in the clinical site. You can certainly use it, during your break if you're in a break room, or during your lunch. Just make sure that you're not on your cell phones. We've had issues with students where there's a little bit of downtime and they're surfing YouTube or whatever. Make sure that you're not using your watch or your phone, your smartwatch or your phone during your clinical rotation. Only during breaks and whatnot. If you do, if you are fearful that there's going to be an emergency, someone needs to get a hold of you during the day, I would suggest that you provide to them the practice phone number, and then anyone would be able to reach you at that time. Just make sure you let your preceptor on site know, hey, I have a family member in the hospital or having surgery or whatever, and I want to keep track. I gave them the number, and then I'm sure they would be more than happy to work with you in that case. If you are removed from a clinical site, this can result in your failing the course. So, so be sure that that you are following their rules, that you're, respecting their guidance and their teachings, and just be careful in that regard because it can result in a course failure, dismissal from the program, etc. So really important to, stay on top of things during your clinical. The other important piece of what we want to talk about today, and let me flip over here, is your clinical packet. So the reason you're hearing from me is because your clinical packet is not complete. These are the elements that need to be completed for your clinical packet to be complete. You need to take a look at the information in your handbook, and you will receive that again. But you need to set up, the first step is really, and I'll go back here to our handbook here for a second. The first step is really to set up an account with Complio. So in your handbook, there's information about how to go to Complio. Complio is where we manage our background check, drug screening, FBI fingerprints, and where you'll upload all of those documents that you just saw. So the first step is to go out to Complio with this website here. So it's udeltarabo.complio.com. So I'm going to show you what that looks like here. So here's the Complio website, pretty straightforward, obviously. If you have not created an account, you're going to go in and create an account. You're going to fill out all this information. Obviously get all that info in there, and then create your account and proceed. And it'll walk you through. There's actually a video at the bottom that can help you with this process, but it's pretty straightforward. Just follow along. And there is a fee associated. I believe right now the fee for the background check and fingerprinting and drug test is $95.50. Fee for uploading your documents, your screening documents, etc. is $27. So you will need to cover those costs. And let's hop back over here to the clinical packet itself. So within this packet, there's a contact information form needs to be filled out. You've likely already done this, which is your document to sign to show that you read the handbook. But if you have not, you'll be asked to do that. There's an infectious disease statement, a pregnancy release, information about the drug testing policy, requirements with regards to flu shots, other disclaimers with regard to the clinical site and types of policies that they have there. But also you need to be uploading your BLS CPR card. You're going to have your background check, which is managed through Complio, your drug test. You're going to need to take some coursework in OSHA, HIPAA, HIV and AIDS, medical error prevention, and domestic violence. In your handbook, there are some helpful bits of information about where you can take these courses. You'll take them, they're typically short online courses, but you'll be managing that. You need to have your physical exam. There's a form in your packet for that. We need to have your immunization titers for Hep B, varicella, and MMR. So you'll need to have blood drawn and show, or if you've already had that done, that's great. You'll need to show that. If your titers are negative, you will need to have the vaccines unless there's a medical reason not to. You'll need your tetanus shot every 10 years. A TB test, so there's different versions, but you'll need to have that done. Your flu vaccine each year, and then COVID-19 vaccines, and potentially testing depending on the site, although we haven't really had many sites testing recently. So all of these items need to be taken care of before we can place you in your clinical site. These are all managed through Dr. Vasquez. Important that you're working with her, getting your Complio account set up as soon as possible. Start uploading these forms. She is there to help. She is there to help. I am here to help to get these processes moving forward for you. And we just want to make sure everyone is successful and completes their internship, externship requirements, clinical requirements in the second half of the summer. So if you have questions, reach out. My email is jharrington, HARRINGTON, @uagm.edu. And I look forward to working with all of you. Thanks.